Alrighty. Hi, everybody. Thanks for joining us today. I'm here with the wonderful Doris from the ISE lab here at NYU GPH. I'm going to give her a quick introduction and we'll get right into sort of exploring what it's like writing a literature review. So Doris is a librarian with the ISE lab here at NYU GPH. She's an adjunct faculty member in the School of Global Public Health and teaches the Global Public Health Informatics course. She received her MLS from the University of Pittsburgh, her MA in English Literature from Brooklyn College, and an MPH with an emphasis in global public health, health promotion, and disease prevention from here at NYU. Finally, Doris is a fellow of the New Academy of Medicine, whose members are distinguished professionals in the medical and health professions, embodying the highest levels of achievement and leadership in urban health. It's wonderful having you here today, Doris. Thanks for presenting, and I'll hand it off to you.
Hey, thank you very much, and thank you all for inviting me to this presentation. I'm going to share my screen, and what we're going to learn today is how to write a literature review. There are so many ways, but there are certain best practices that if you follow, you will have a really good review. And there are many reasons why you want to write a review. And I know that you're working with NGOs, so you want to tailor your output to what your organizations need. So, how do you get started to write an effective review? It all comes down to the research question. The first thing you have to do is develop an appropriate research question. And there are several frameworks that are out there. One used to be called PICO, and then they added a TS to it, depending on what their question was. But T would be time frame, S would be study design. So you can tweak the research question framework to meet your needs. Another one is PEO, and that's what we're going to use today. PICO stands for patient, problem, and population, intervention, comparison, if applicable, and outcome. PEO is problem, could be patient, problem or population, exposure, and outcome. And then you can look up Spider, Spice, and Eclipse. These are just other models that will help you get the information you need. I'm going to send this document to you all with the links. So I will put the links into these different models. After you have a well-framed question, and one of the things that Lois and I were talking about is when you work together in a group, you can frame a better question. So don't just come up with a question on your own. Run it past someone and see if they feel that you do. This is a strong question. Then you need your blueprint. How are you going to conduct this structure? How are you going to structure this research question? Well, there's something called Prisma. And they have a lot of templates for you to do reviews on different types of questions. Some journals, there are journals that actually publish protocols, or the journal that you're hoping to publish in might allow you to publish the protocol. Most people will publish their protocols in these types of things. So I'm going to click on Prisma, and I have two pieces set up to make it easy. So when you go to Prisma, if you're doing a systematic review, this is the checklist. This is your blueprint, like you're building a house, we're building our literature search. This is the Prisma checklist for the systematic review. We're going to see what Lois's question is, and it's going to be a scoping review. So we're going to go here to the Prisma extensions, and you can see the different types of checklists that they have. So, are you doing research on equity? Are you doing harms, preventing harms? I think they did a lot of systematic and scoping and other types of reviews when COVID came out. So, we're going to use if we were going to use the Prisma scoping review, I can get a Word document or a PDF file. Here are all the different ways of navigating through the review, and it tells you what type of title do you want to set? Set a title that's meaningful. I can't tell you how many times come across titles and we exclude them because the titles don't make sense and they might be something we need to look at. A structured summary, you're going to see that in a minute. What's your rationale? Who cares? Why are you doing this review? What objectives are you trying to achieve? Register your protocol. If you're doing a scoping review, you need to register it in something called OSF.io. If you're doing a systematic review, you can register it in OSF or Prospero. Eligibility criteria. What is it that you're looking for? What are those variables that you need? What are the top three? If those top three variables aren't there, you can exclude the article, but you want to put all of your variables in. What information sources, what databases do you need to search? You really need to check with a librarian. If you're doing a systematic review, Cochrane says you have to search the Cochrane Library, PubMed or Ovid Medline, and Embase. Those three databases, and they say that's sufficient. Now, you should be asking yourself, well, what if my topic is on psychiatry? They didn't mention a psychiatric database. So your information sources go back to that very important question. I search minimally 7 databases for every review that I do. So I typically search PubMed. I will search Ovid Medline, even though Medline is in PubMed, because their algorithms are different. I will search Embase. I will search the Cochrane Library. I will search CINAHL, which is the Cumulative Index to Nursing and Allied Health. If you're doing a global topic, you should be searching PAIS International, Public Affairs International. I will search Global Health Database and I will search Web of Science. If I have a very specific topic that's environmentally related, which you're going to see in this question, I might want to search it's called Environment Complete. If I'm searching on a topic for aging, I might want to search AgeLine. So there are very specific databases that you can search that are key to your question. We're going to see how to set up the search strategy. How do you select sources of evidence? How do you chart your data? And you're going to see that later in your data items. 5 years ago, if you were doing a scoping review, you did not have to do a critical appraisal of the individual articles. They will say critical appraisal or risk of bias assessment or quality assessment. So there's a lot of terminology that's thrown around, but we cannot control the articles that have been published. I wish peer review was stronger in a lot of cases. I know that you have said to yourself, how on earth did this article get published? You don't throw it out. There's a way to score it that's unbiased, and you just give it a quality rating. How are you going to synthesize your results? Okay, and then you can see the rest of the steps. So a lot of these are related. How you're going to summarize your evidence. What are your limitations, conclusions, and did you receive funding for this review? So again, you're going to be able to link to the Prisma checklists. And if you're doing a systematic review, a lot of tools will create the flow diagram for you. And if you want to understand everything about doing a systematic review, here are their papers. So that's the Prisma checklist and registering your protocol. Then, what are the tools you're going to use? Now, I understand that all of you are from NYU. Please tell me that you're using EndNote, and you're going to see a really brief demonstration of EndNote. What is significantly important about EndNote? It's the only bibliographic management program that allows you, that literally goes and finds the full text for you. For the other packages, you have to find each individual article and attach it, find an article and attach it. EndNote can't find everything. And no one should tell you, oh, it will find 50% of your articles or 75%. That is so wrong. It depends on our collections. So we have things set up in a way that EndNote will try to search our collections and pull it in. And there's a lot of free full text out there. Covidence is a tool for manage any type of literature review. We'll see that. A lot of you are going to be using the Google tools, Google Docs, Google Sheets, and Google Forms. One thing that's very important, and I'm going to click on it right now because it'll only take a second, it's how to write a manuscript. Oh, it looks like I closed up the link. Okay, so I will click on it. How to write an article and get it published. Okay, how to write an original research paper and get it published. Okay, very short, one page front to back. When you write your introduction, and if you're writing for an NGO, what they want to know is what is known in the literature about this topic, what is unknown, pardon me, and what is your burning question, hypothesis, or aim. They put the hypothesis and aim in, but they should always go back to your burning question. Keep it short. Write for a general audience so they understand what you're trying to say. And again, it tells you everything you need. What methods you need to describe. Be very clear in your methods. Results, again, very short, tells you about your tables. If you need to cite the number in the text, not just in the table, there are instructions for authors and they tell you exactly what you need to do. This is why this is so short. Your discussion. One thing that people confuse, and again, peer reviewers aren't 100% reliable. People mix up their results with their discussion. Results should specifically be what you pulled out from those 20 articles that met your criteria. Your discussion is your summary of your results, what people might want to consider for future research or for implications for the general public. Again, who are you writing for? Don't overreach. These are tips on writing. This is me. I am a Migo person. My eyes glaze over, or your eyes will glaze over when you read, because I like to write broadly and then cut it down. We all have different writing styles. So make sure that you're sharing your writing process with someone else before you give it to the final person that's supposed to take the information. Every single paragraph should be lucid. I know your students. I know you're trying to show your intelligence. There's nothing wrong with that. But do not write a sentence with 20 words where they're going to have to look up what you're trying to say in the thesaurus, or where they may mix up what you are trying to say. Keep it lucid, short and simple. And then, why are you telling me this? Who cares? Again, make sure that it's important. So the link is here to this short article, and it will help you get centered. Okay, so we're going to work on a real question, and Lois is going to interject any time that I fall off the mark and help me straighten out the research process. So he gave me a question. What are the potential intervention strategies that NGOs can implement in response to climate-induced meningitis outbreaks in northern Ghana? So what did I highlight? I highlighted I highlighted the terms that are going to be used in the search. So we have our intervention strategies, climate-induced meningitis. So that's going to come from climate change. So he helped me understand that the meningitis that we're talking about is bacterial meningitis. Okay. Climate change. I'm working on a review right now on climate change. So, this is the most comprehensive liter or section of the search on climate change. And we started this last fall in the fall semester. So, as time goes on, more words might come up. I'm trying to think of something cute for tornadoes, the tornado effect, but that won't do it either. But you put all the words that are important in here. You see, tornadoes is actually not in here because the project that I'm working on, this will not impact northern Ghana. They don't have tornadoes, hurricanes. So you put in all the terms that are important. This section also needs to be developed further, but what are other ways that we can say intervention? The asterisk is for intervention or interventions, program or programs, health promotion. Um, I'm going to say or. outcomes assessment. Now, what is TW? And I have a really strange one in here. Do you see where it has bacterial meningitis, TW, bacterial meningitis mesh? Why don't I just do TW? Because TW will search in the title field, the abstract field, the author's keywords. It will search in the medical subject headings field. So if it's searching in the medical subject heading field, why do I have to have that? So let's go over to mesh and let's look at that. When I type in bacterial meningitis, that is a subject heading. What you want to type in is literally the way that we say this term naturally. We do not say meningitis, comma, bacterial. Let the system work for you. So we have our bacterial meningitis. The system will go over to this as mesh. But as we go down, you can see there are more specific terms underneath bacterial meningitis. So if you only search this as a TW, it will not pull up these additional terms. And sadly, a lot of lay persons do not know this, and a lot of librarians don't know this. I'm a medical librarian. Hopefully, most medical librarians know this. But please understand, if someone tells you you only need the TW, you are now trained to know that you need both TW or mesh. If there is a term where there are no specific, I'm just going to click on this one. See, there are no more specific terms underneath. Then I could do Listeria meningitis, TW, and it would pull up everything. So this is for your personal preference. You can always say what the subject heading is and mesh or TW, or you can go in, take the time, look at the medical subject headings, so you'll know which one to put in. And I'm definitely going to need Lois on this because I'm going to run this search across several databases. And one of the databases I did not put in, I'm going to put in the list of databases for this project, even though I'm not going to search all of them. So I'm going to do PubMed. I'm going to do Embase. I'm not going to do Medline Ovid, and I'm going to do Web of Science. But an important database would also be Environment Complete. I also like to search Google Scholar because Google Scholar can search down to the PDF level where these databases are only searching in certain fields. And the other database that I'm not going to I'm not going to search it, but it's very important for you to know is PubMed Central. And they are now just abbreviating it. So you might see PMC in a lot of places, but that is PubMed Central. It's a full text database, nothing but full text, but it's going to search very broadly. So I typically in Google Scholar and PubMed Central look at the first 3 pages. If I'm getting a lot of hits in those first 3 pages, I need to adjust my strategy. It's not well. So I would go find that article, put it into PubMed, and see what subject headings they're using. So we'll see a little bit about this. So, Lois, I'm going to put this into PubMed now, or actually, before I do that, I want to show you very quickly EndNote. So, EndNote is free to you for now. I'm going to create a new library. I'm going to call this meningitis. I'm going to put it on my desktop and save it. Okay. Because I want to put the records in here so I can show you how to get the full text. So one of the first things I want to do, now please hear this. You have to follow up with your libraries and you have to be an advocate for yourself to get the most information. Remember, your tuition is paying for this. There's a problem with the BOPS library Ovid databases. Ovid is the company and it has several databases in it. It's not loading all of the information. So my concern is if you're searching Ovid, I'm going to go into Ovid Medline. I'm not going to search it, but I want to show you what happens. I'm searching from the medical library to make sure I get all of the data. If I go in through the BOPS data, I'll be wasting your time. And I haven't seen any messages saying that they have it working yet. Come on now. But what I'm going to need Lois to help me with is to improve the strategy if we're getting either too much information or not enough. Okay. So Ovid is the company. You cannot say I searched the Ovid database, and peer reviewers don't know the difference. Then I click on change, and these are the databases that are available within Ovid. So I can search for book information. I can search Ovid Medline back to 1946. EBM reviews, this is all Cochrane. Here's the global health. If you're in psych, there are psych and social health and psychosocial instruments. This is called HAPPY. Journals at Ovid full text, just like PubMed Central and Google Scholar. It doesn't have medical subject headings or what is called a controlled vocabulary. Searching free text and you can find great articles. So these are all these databases are in here. So I said I'm going to search Embase. I wish they wouldn't have the rollover, but this Embase goes back to 1974. Very important for how back you want far back you want to go. Please do not say if this is a real professional question or if you're doing this for public health or healthcare, do not say I want the most current 5 years unless you're doing a rapid review. Do this search based on when did meningitis start appearing in the literature? When did they start coming up with interventions? You may want to go back in time. And even though an intervention from, let's say, 1960 may not be relevant in 1925, that article may give you a thought about how you might change that old intervention to something that's new. This Embase goes back to 1947. So I'm just going to take that one because I want to get everything. Okay. But what I'm going to do is I'm going to start with the PubMed database. So I'm going to actually access that from the medical library. I'm just going to click on PubMed and it takes me right in. If I want the mesh database, it's down here. When I set up my searches, I always keep the PubMed database open and the mesh database so I could toggle back and forth to get the subject headings that I need. So this is the general um, search strategy that I came up with. Before this systematic review accelerator polyglot tool came out, I literally, remember I said I searched 7 databases? I literally had to translate every single search where I had TW and these codes appropriately for each of the databases. I no longer have to do that, and you'll see that in a second. This program is so cool. It's going to save you hours of time because it will translate the database for you. So the first thing I'm going to do is paste the strategy in here and say search. See, I only get 3 results. So what I want to ask myself is this strategy too specific? And I'm going to take out the TWs. So that means I only need this actually. Just look for everything, oops, everything on bacterial meningitis. And if this does not increase it enough, then we might have a problem. And that's what I need Lois to talk me through. So I'm going to say search again, and it only increased it by 2. And what do you see unique about record number 3? You see these brackets around it. The brackets indicate that it's a foreign language. And again, before Google Translate came around and some of these other translators, a lot of people would exclude foreign languages. You should not be excluding foreign languages. Not all of the translators are great, but you can capture the introduction, the last paragraph of the introduction. That's where they'll typically tell you what their aims are. You can capture paragraphs from the methods. You can capture paragraphs from the results and pretty much translate that. But general, like Arabic language is not easily translated in Google Scholar. So you just have to pay attention. foreign language. But what I'm going to do is I'm going to ask Lois to please help me determine what the subject or the additional terms we might use. So I put in programs. You see it's highlighted in pink. We have meningococcal infections. And remember, this is the one where I took out bacterial meningitis. So it's trying to pull everything in.
Right.
Can you think of other terms that we could put in? If I put in meningococcal infections, will that be out of scope of what you're looking for?
No, I think that would be within the scope. I know mesh also has just meningitis as one of its potential terms, so that may be helpful too.
So I can go up here now. I was trying to copy it so I wouldn't have to misspell it. MeninIN. Ooh, I'm so sorry. My spelling's bad here today. Menning, oh, cococo. I just want to copy the word. Can I copy that?
Yeah, you can copy it from there you go.
Thank you. Okay. I'm going to search again and let's hope we get 30. Hope we get 11. Okay. And again, we're going to go through other databases so that may help us with what we need. This is something, this is because this is real time. Something came up just now that I typically wouldn't have taught, but you see, this is a study protocol. That's your Prisma checklist. A study protocol isn't going to give you results. It's your blueprint. So their blueprint was published in BMJ Open. It's not going to give you any data. What it's going to tell you is what they're doing and that you don't want to do the same thing they're doing. Um, this is 4C Men B. Okay. And so all that I'm going to do is say, send this to my citation manager. And if there were more than 11 results, I would just say all results. Create my file, went to my downloads, and now it's in PubMed. And I can organize this by databases. I can organize this by topics. I might want to stratify by children versus adults versus the elderly. I might want to stratify by country. This is an exceptional tool to help you with what you need. Then I'm going to look at advanced. This is very important. And this is telling me how my search is working. So here are my details. This is how you saw what I typed in. This is how it changed and translated my search. Um, Can't think of anything else to show you here. I'm going to go back to the 11. And when you don't put in TW, I'm going to show you, I can show you from here too. These terms are being searched in the title, the abstract, the author keywords. Now, if it doesn't have a TW, it's going to look for the terms in the similar articles. If these articles were cited, it would look in the cited references. It's looking in these references. And it's looking in the subject headings. So it's looking in all of the fields. So meningococcal or meningitis might be in the similar articles, and the climate change, totally unrelated, might be in the title. So you're going to get more things that aren't relevant, but you won't miss something that is relevant. So you don't want to do this for 11,000 results. That will drive you nuts. You don't want to screen 11,000 results unless they're really relevant. Okay, so now remember, I have my strategy, and all I want to do is go to this SR accelerator, copy, and paste my strategy in. And then as I scroll down, it translates it for Ovid Medline. So see where I have these TWs? It changes it to an MP, which is multi-purpose fields. If I'm searching Embase Elsevier versus Embase Ovid, but all the Ovid databases use the same codes. When I go to CINAHL, I'm not going to show that now, but I'm going to show you how to use this type of effect in Web of Science. Okay. So all these other databases. So you can edit these. You can do your PubMed search and capture these. You just simply copy it and just dump it in. So I'm going to copy the Embase Ovid. Here's my copy. Here's Ovid. I can see I'm in Embase. Just paste it in. Embase and PubMed are competitors. This is actually stronger in the global literature. Come on now, work a little faster.
I think while we're here, Doris, I guess a question to ask, especially for folks, how do you keep your search strategy solid without taking away from your research questions? So, for instance, if I'm using this search strategy and I don't find a lot of articles about meningitis, and I keep broadening it out further, either based off of mesh or other search terms, how do I make sure that the scope of my strategy is still relevant to the question that I'm asking?
Excellent question. And that's what you all need to do. So, to do that is there something that I can remove? I'm going to go back to advanced. Is there something that I can remove from here? So, I know I can get a lot more by removing this. I'm going to click on the ellipses here, the three dots, and say add query. It puts it up here. I'm going to get a lot more because I'm going to take off this portion of the search. I'm going to say search. And now look at that. I have 58. So when it comes to the subject headings that are applied, we're looking for interventions. Well, what if they've done an intervention, but they didn't use that word? Now I can go through here and see if there are any other things that are related to interventions. So I haven't lost the integrity of my search. I still have the meningitis and I still have the climate change part. But I'm going to have to look through 58 and make sure it's really covering what what I'm looking for. For example, I don't know if this one came up in the first one, but they're talking about post-program intervention. And it's a good thing I put the asterisk after program because I didn't do the British spelling with ME. Um, Temporal relationships. It might be wise to look through this because though they may not be covering intervention, in their discussion, they may say this type of intervention is needed. So it gets a little interesting when you're trying to broaden the scope when you're not getting enough. But that was an excellent question. Don't lose the main part of your search. If you get to this part, and I did not do a comprehensive search, if Lois asked me to do this for a real project, I would take minimally 2 hours to construct this strategy, minimally. And then I go through and I look at the similar articles, the cited references. I always do this in Google Scholar when I'm not getting a lot of information. And I go back. I can give you a great example. Gentrification. Gentrification is not a medical subject heading. There is a subject heading for it. I think it's residential characteristics or something like that. But before it came a subject heading, it became a subject heading in 2024. I searched Google Scholar and everyone kept saying, how did you get these great articles? How did you get these great articles? Because again, Google Scholar searches down to the PDF level, not on everything, but on a lot of articles. I put the articles in PubMed and then I looked at the subject headings. Okay, look, effective Hurricane Maria on menin. So do we want to just say meningococcal? Okay, I'm going to click on this one. I'm looking in here. They just say the vaccine. Look through here, mesh terms. Okay, and again, I'm not finding anything. Did that answer your question okay?
Yeah, yeah,
Yeah.
absolutely.
So I only get two, and I just go here. I'm going to take all of them. I'm going to say export. I always want everything, as much information as I can get. Say export, click on it. It dumps it right in. I can set up group sets, but these are all of my references. And I don't see any duplicates yet. I'm going to sort by record number just to make sure. Look at that. So why were these two in Embase and not in PubMed? And then the other database I want to show you, actually, if you don't mind, I'm just going to say change. I'm going to do global health real fast. Lois, how am I doing on time?
You're pretty good on time. I'd say you have about 6 minutes,
Okay,
six,
good.
7 minutes. Yeah.
Thank you. I'm just going to do global health very quickly and run search. And we got two. This one's a book. And I'm just going to look over here and see if I'll sort by author. That one didn't come in. And this is why it's important. I'm just going to click on this one because I don't want the book. Export. Why don't I see?
Uh,
There it
right
is.
there.
Sometimes. Okay. And we have our 14. So SR Accelerator will save you a lot of time. Figure out all the databases that you need. I'm in EndNote now, and I'm going to log off of here because I don't want to block anyone out. So always try to remember to log off. Now, when I'm in EndNote, one of the nice things is I can search for duplicates, but it doesn't look like we have any. So I go to library, find duplicates, just make sure. That's really interesting. Other database, I'm sorry, I do need to do is Web of Science. Web of Science covers a lot of different databases, but again, it has a different algorithm. And so what I want to do is I want all databases. You can see. So we want the biological databases. And this is where it gets different. So when I'm in SR Accelerator, here's Web of Science. It's a generic search. So anytime you have boxes. So CINAHL, the ProQuest databases, the EBSCO databases, they have these boxes. All that you do is you want to search in the title field for all of your terms. Add a row, change this to or. Any words in the title or any words in the abstract. This one does not have a subject headings group, but in CINAHL, I might say, or any words in the subject headings. And now I say search, and I get 6. Some of these are going to be duplicates. And I can send them over to EndNote. But for time's sake, I'm not going to do that now. But now I'm curious, did the pause come up? See why it's so important? Pause is not in here. So what I want to do very quickly is this is not a lot of references. I'm going to tell EndNote, go up to references. If you're going to use EndNote, you go through the Bose library, you will get codes that will allow you to search for full text. So I'm authenticated already. It's searching. And when it finds, as soon as, look at that, it found one article already. Two aren't found. It found another one, the paper clip. It goes really quickly. Almost done. And that's why you cannot say how good is EndNote at finding it. It depends on the topic. I can work on another topic and only get two and have to go in and find the references. And when I find the URL, depending on how Bope's library set it up, I can click on this and get the article and attach it. Two to go, a little faster. Maybe I can do it while we're waiting. I'll click on this one. Okay, see, and then I pull down my menu. It's not letting me pull it down. Okay, I'm going to open with preview, and I can go through, read this article, and highlight whatever's important. You know how to use this tool for PDF. So you can highlight, you can take notes, you can ask questions, you can do a lot of things in here. So that's why I wanted to show you this. And you can search on keywords and things like that within here. So that's very important. Okay. The other thing I just want to show you very quickly is, and these are just demos. These are from projects that Lois and I may be working on in the lab. So we're working on a project. It's on gaslighting. So, how are you pulling out your data? Understanding the variables is very important. So, what we found out are there are different types of gaslighting. There's medical or clinical. There's intimate partner violence or domestic violence. There's workplace or institutional gaslighting. Blew me out of the water. I did not know that a colleague might try to make another colleague feel like they weren't doing a good job and gaslit them. Academic gaslighting so other people don't get a promotion. Race related, technology related. We have miscellaneous, and there is so much now on political gaslighting. Then, what are the variable fields? So, in this case, we need a definition of how they're saying gaslighting in these areas. What's the maternal or impact on women? Number of women that were studied, country, because this is a global project, and if they specify by race or ethnicity, are we seeing things that are different? So, it's something very important that you have to pay attention to because you don't want to have to go back and redo your pulling out of data, your data extraction. You see, I have quantitative measures here in bold. Make sure you understand what quantitative measures mean because we do have to do this on another project. We were only looking at effect size. Now we have to go back and get confidence intervals, p-values, and any other statistical measures that we missed. Google Tools, you're comfortable with them. I showed you the one piece. These are the main sections of your manuscript, but the NGO that you're working for will tell you how they want you to structure what you're looking for. And how am I doing on time? There's one last thing to show if we have 2 minutes.
You got 2 minutes.
Okay. So there is a tool that's amazing. I'll go through the BOPS library. It's called Pubs Hub. And what that does is it helps you find where you might want to publish. Oh, I just didn't search for it, but that's okay. We're almost there. Pubs Hub. Are you kidding me?
The wonders of
Oh,
NYU.
I'm so glad I have an iWatch. And this is really quick. So let's say we're looking for a therapeutic area. We want to know where uh, Lois works with his NGO, and they said, this is really good. We want to publish it. So I don't know if they have infectious disease as an area. Let's see if I can make this a little bigger. Yes. So let's find the top journals in infectious disease. So we have 369 journals. I don't want things that are no longer publishing, so I say exclude the ceased publications. It cuts it down a little. But now, how do I pick what I want? Well, first I'm going to look at impact factor. You always have to click on these twice. So this is really high. It's hard to get published in the New England Journal of Medicine, and they have a 95% rejection rate. Okay. So, but you can look at impact factor. Then, if I want to look at rejection rate, again, you have to click twice. So these, I like to shoot for lower 90s, mid 80s. Science translational medicine, that sounds good. Clinical and experimental medicine. Lancet infectious disease. Okay, I might go for that. So when I click on this, it gives me all the background information. I can click on author guidelines, therapeutic areas, what they accept and what they don't accept, all these different pieces. So you get a lot of really great information. It's called Pubs Hub. I will link to it on this page to make it easy. So all that I have to do is go in and finish the links. I will send this to Lois and he will share this document with you.
Excellent. Well, that
Yeah.
was fantastic, Doris. Thank you so, so much for
Maybe
presenting to
my
us.
pleasure.
And if folks have any questions, can they just email you or what's the best way to get in contact
They
with?
can email me, but it's probably best to start with the Bopes Library.
Okay.
And because I do a lot of things, as Lois knows, I've worked with the IC lab, so I stay fairly busy. Bopes can probably get to you a little bit faster. I'll make sure I put my email in here,
Okay.
which is a little bit weird. So this will get to me NYU um, but we use a different ID. So you can email me, but if I don't get back to you within 2 days, follow up with Bopst.
Alrighty. Sounds
Okay.
good. Well, thanks again, Doris. Thanks for presenting to our students. That was absolutely wonderful. Hopefully, we can have you present again. We'll see.
Thank
But
you.
otherwise, have a good one.
Thank you. You too. Bye now.
Bye.